In the ever-evolving landscape of healthcare, the development of effective antiviral medications has been a game-changer. Among these remarkable drugs, Oseltamivir, also known by its brand name Tamiflu, stands out as a powerful ally in the fight against influenza. As we delve into the intricacies of this medication, we will unravel its common uses, advantages, potential adverse effects, dosage recommendations, and the dangers associated with its use. Oseltamivir is an antiviral drug that belongs to the class of neuraminidase inhibitors. It works by blocking the activity of a specific enzyme, neuraminidase, which is essential for the replication and spread of influenza viruses within the human body. By inhibiting this enzyme, Oseltamivir effectively disrupts the virus's ability to infect new cells, thus limiting the severity and duration of the illness. Common uses of Oseltamivir. The primary use of Oseltamivir is in the treatment and prevention of influenza, commonly known as the flu. It is particularly effective against influenza A and B viruses, which are responsible for the majority of seasonal flu outbreaks. Oseltamivir is typically prescribed when an individual exhibits symptoms of influenza, such as fever, cough, sore throat, body aches, and fatigue. However, Oseltamivir's applications extend beyond treatment. It can also be used as a preventive measure in individuals who have been exposed to the influenza virus but have not yet developed symptoms. This prophylactic use is especially beneficial for high-risk groups, such as healthcare workers, individuals with compromised immune systems, and those in close contact with infected individuals. Advantages of using Oseltamivir. Shortens the duration of illness. When taken within the first 48 hours of symptom onset, Oseltamivir has been shown to significantly reduce the duration of influenza symptoms by approximately 1 to 2 days. Reduces severity of symptoms. In addition to shortening the illness duration, Oseltamivir can also alleviate the severity of influenza symptoms, such as fever, body aches, and fatigue. Lowers risk of complications. By effectively treating influenza, Oseltamivir can potentially reduce the risk of developing serious complications associated with the illness, such as pneumonia, bronchitis, and sinus infections. Preventive benefits. As mentioned earlier, Oseltamivir can be used as a preventive measure for individuals at high risk of contracting influenza or those exposed to the virus. Potential adverse effects of Oseltamivir. While Oseltamivir is generally well tolerated, it is essential to be aware of the potential adverse effects associated with its use. The most common side effects include nausea and vomiting, diarrhea, headache, dizziness, fatigue. In rare cases, more severe side effects have been reported, such as neuropsychiatric events, e.g., delirium, hallucinations, abnormal behavior, skin rashes or allergic reactions, hepatitis, inflammation of the liver, seizures. It is crucial to consult a healthcare professional if any concerning side effects arise during treatment with Oseltamivir. Dosage recommendations for Oseltamivir. The dosage of Oseltamivir varies depending on several factors, including age, weight, and the intended use, treatment or prevention. Here are some general dosage guidelines. Treatment of influenza. Adults and adolescents, is greater than or equal to 13 years, 75 mg twice daily for 5 days. Children, is greater than or equal to 1 year. Weight is less than or equal to 15 kg, 30 mg twice daily for 5 days. Weight greater than 15 kg to 23 kg, 45 mg twice daily for 5 days. Weight greater than 23 kg to 40 kg, 60 mg twice daily for 5 days. Weight greater than 40 kg, 75 mg twice daily for 5 days. Prevention of influenza. Adults and adolescents, is greater than or equal to 13 years, 75 mg once daily for at least 10 days. Children, is greater than or equal to 1 year. Weight is less than or equal to 15 kg, 30 mg once daily for 10 days. Weight greater than 15 kg to 23 kg, 45 mg once daily for 10 days. Weight greater than 23 kg to 40 kg, 60 mg once daily for 10 days. Weight greater than 40 kg, 75 mg once daily for 10 days. It is crucial to follow the prescribed dosage and duration of treatment as recommended by a healthcare professional. Deviating from the recommended dosage or stopping the medication prematurely can reduce its effectiveness and potentially lead to complications. Dangers and precautions associated with oseltamivir. While oseltamivir is generally safe when taken as prescribed, there are certain dangers and precautions to be aware of. Allergic reactions. Oseltamivir can cause severe allergic reactions in some individuals. If you experience symptoms such as difficulty breathing, swelling of the face or throat, or severe rash, seek immediate medical attention. Neuropsychiatric events. Rare but serious neuropsychiatric events, including delirium, hallucinations, and abnormal behavior, have been reported in some patients taking oseltamivir. Close monitoring, especially in children and adolescents, is recommended. Bacterial infections. Oseltamivir does not treat bacterial infections, such as bronchitis or pneumonia, which can sometimes occur in conjunction with influenza. If symptoms persist or worsen, seek medical attention. Renal impairment. Dosage adjustments may be necessary for individuals with renal impairment, kidney problems, as oseltamivir is primarily eliminated through the kidneys. Pregnancy and breastfeeding. Oseltamivir should only be used during pregnancy or breastfeeding if the potential benefits outweigh the potential risks. Consult a healthcare professional for guidance. It is essential to disclose any pre-existing medical conditions, allergies, or medications you are taking to your healthcare provider before starting oseltamivir treatment. Comparing oseltamivir to other antiviral medications. While oseltamivir is a widely used antiviral medication for influenza, it is not the only option available. Other antiviral drugs, such as zanamivir, Relenza, and baloxavir marboxil, Exofluza, also play a role in the treatment and prevention of influenza. Zanamivir, like oseltamivir, is a neuraminidase inhibitor but is administered via inhalation rather than orally. It is generally well tolerated but may be less suitable for individuals with respiratory conditions like asthma or chronic obstructive pulmonary disease, COPD. Baloxavir marboxil, on the other hand, is a newer antiviral medication that works by inhibiting the cap-dependent endonuclease enzyme, which is essential for viral replication. It has shown promising results in reducing the duration of influenza symptoms and is typically administered as a single dose. The choice of antiviral medication depends on various factors, such as the severity of the illness, the patient's age and overall health, potential drug interactions, and the specific strain of influenza virus. Healthcare professionals carefully evaluate these factors to determine the most appropriate treatment option. Frequently asked questions about oseltamivir. How effective is oseltamivir in treating influenza? Oseltamivir has been shown to be effective in reducing the duration and severity of influenza symptoms when taken within the first 48 hours of symptom onset. However, its effectiveness may vary depending on factors such as the specific strain of influenza virus and the individual's overall health. Can oseltamivir be taken as a preventive measure against influenza? Yes. Oseltamivir can be used as a preventive measure, prophylaxis, in individuals who have been exposed to the influenza virus or are at high risk of contracting the illness. In such cases, a lower dosage is typically prescribed for a specific duration. How long does it take for oseltamivir to start working? Oseltamivir begins to work within a few hours of taking the first dose. However, it may take a day or two before significant improvement in symptoms is observed. Can oseltamivir be taken with other medications? It is important to inform your healthcare provider about any other medications you are taking, as oseltamivir may interact with certain drugs. Your healthcare provider will assess the potential for drug interactions and provide appropriate guidance. Can oseltamivir cause resistance in influenza viruses? While rare, it is possible for influenza viruses to develop resistance to oseltamivir, particularly if the medication is not taken as prescribed or if treatment is discontinued prematurely. Healthcare professionals closely monitor for the emergence of resistant strains and may adjust treatment recommendations accordingly. Conclusion: Oseltamivir, a powerful antiviral medication, has revolutionized the treatment and prevention of influenza. Its ability to shorten the duration of illness, reduce symptom severity, and lower the risk of complications has made it a valuable tool in the fight against this potentially debilitating viral infection. While Oseltamivir offers numerous advantages, it is crucial to be aware of its potential adverse effects, dosage recommendations, and the dangers associated with its use. By following the guidance of healthcare professionals and adhering to the prescribed treatment regimen, individuals can maximize the benefits of this medication while minimizing potential risks. As we continue to navigate the ever-changing landscape of viral infections, Oseltamivir remains a vital component in our arsenal against influenza. Its responsible use, in conjunction with other preventive measures, can help mitigate the impact of this illness and protect the well-being of individuals and communities alike. If you or a loved one are experiencing influenza symptoms, it is essential to seek medical advice promptly. Our team of healthcare professionals is dedicated to providing comprehensive care and personalized treatment plans tailored to your unique needs. Don't hesitate to schedule an appointment and explore the potential benefits of Oseltamivir or other antiviral medications. Together, we can overcome the challenges posed by influenza and prioritize your health and well-being.